how you doing? This is TV and school. Вивчаємо з тобою ми англійську. How are you? Що скажеш, коли ти зустрінеш якогось іноземця? So, let's speak English. Англійська мова Шекспіра та нью-йоркських таксистів. Англійська стане у нагоді вам, бойс і дівчиська.
Hello, my name is Olga Manmao and welcome to today's lesson. The reason I have this in my hands, it's obvious. Let's talk about something that everyone is talking about nowadays. Something that has a great impact on lives of every citizen of this planet. It has changed the way we work, live, socialize, travel, move around. It has changed everything. Our lives will never be the same. As you probably guess, we're going to talk about coronavirus, or COVID-19 as it's called. It all started in December 2019 in the Chinese town of Wuhan. Let's have a look at the map. There are many sources of information concerning COVID-19, but the one I trust and the one I suggest everyone uses and checks the updates is the World Healthcare Organization. Yes, have a look at the website. I did check the information yesterday, and as you will see, there are more than 4,004,000 confirmed cases all over the world. And the death rate, as you will see from this slide, United States has the biggest number of contaminated people, while Russia and then the United Kingdom go next. The countries with the best and the biggest developed economies are struggling to fight this disease. As for Ukraine, on a single day, on the 16th of May, there are more than 528 cases registered in a single day. The total number of people having the disease in Ukraine is more than 17,000. Shocking news. However, it's up to you and me to stop the disease from spreading. When we watch the news, there is a new word we hear concerning this disease, and it's called pandemic. Let's have a look at the information that I've borrowed from Wikipedia, telling us what this disease is. A pandemic is an epidemic of disease that has spread across a large region, for instance, multiple continents or worldwide, affecting a substantial number of people. Throughout human history, there have been a number of pandemics of diseases. The most fatal pandemic in recorded history was the Black Death, also known as the Plague, which killed an estimated of 75 to 200 million people in the 14th century. Other notable pandemics include the 1918 influenza pandemic, or Spanish flu as we know it. Current pandemics include HIV, AIDS, and COVID-19. Let's have a look at the text again. There are 4 missing words that you will see. Current, spread, estimated, and include. Read the text yourself and try to match the words with the missing parts in the text. A pandemic. Now, on the screen, you can see the text with the words in it. I hope you've managed to do it well. Now you know what the pandemic is. It's worldwide and it's growing fast. Not only has this disease changed our lives, it has brought some new vocabulary into our lives, if we talk in terms of English. Let's have a look at some of the words that we now hear in the news. We read them in the articles. We see them on infographics concerning the disease. The origin, that's where the disease comes from. The disease itself, outbreak. To prevent, safety measures, confirmed case, surface, transfer, vulnerable, spread as a noun, and to spread as a verb. These are the words we will have in the text today, we'll hear in the videos, and I'm sure again, you use them in your everyday life nowadays, unfortunately. We all have questions about this disease. We all have questions about this pandemic. I suggest we all watch a beautiful video created by WHO that answers some of the questions. Question number 1 is, how contagious is this disease? Question number 2, what are the symptoms of it? Question number 3, how do we prevent it from spreading? And the last one, and probably the most important one, how do we stay safe? When I say we, I mean you and me, your family, your friends, your grandparents, the society, the country, the whole nation, and all the citizens of our Earth.
In December 2019, there was a cluster of pneumonia cases in China. Investigations found that it was caused by a previously unknown virus, now named the 2019 novel coronavirus. In this video, we'll take a quick look at what's currently known about the virus. Keep in mind that this is a new virus, and what's known about the virus now might change in the future. Coronaviruses are a large group of viruses. They consist of a core of genetic material surrounded by an envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause respiratory and sometimes gastrointestinal symptoms. Respiratory disease can range from the common cold to pneumonia, and in most people, the symptoms tend to be mild. However, there are some types of coronaviruses that can cause severe disease. These include the severe acute respiratory syndrome coronavirus, first identified in China in 2003, and the Middle East respiratory syndrome coronavirus that was first identified in Saudi Arabia in 2012. The 2019 novel coronavirus was first identified in China. It initially occurred in a group of people with pneumonia who'd been associated with a seafood and live animal market in the city of Wuhan. The disease has since spread from those who were sick to others, including family members and healthcare staff. There are many cases at present, and the disease has spread within China and also to a number of other countries. So, where did the virus come from? It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from animals to humans. This is called a spillover and could be due to a range of factors such as mutations in the virus or increased contact between humans and animals. For example, MERS-CoV is known to be transmitted from camels and SARS-CoV from civet cats. The animal reservoir of the 2019 novel coronavirus is not known yet. How is it transmitted? The exact dynamics of how the virus is transmitted is yet to be determined. In general, respiratory viruses are usually transmitted through droplets created when an infected person coughs or sneezes, or through something that has been contaminated with the virus. People most at risk of infection from the novel coronavirus are those in close contact with animals, such as live animal market workers, and those who are caring for people infected with the virus, such as family members or healthcare workers. So, how does the disease present? Well, from what is known so far, there can be a number of symptoms ranging from mild to severe. There can be fever and respiratory symptoms such as cough and shortness of breath. In more severe cases, there's been pneumonia, kidney failure, and death. The mortality rate is not known yet. How can we tell whether someone is infected? The infection can be diagnosed by a test called PCR, or polymerase chain reaction. This test identifies the virus based on its genetic fingerprint. There's currently no specific medication for the virus, and treatment is supportive care. There's currently no vaccine to protect against the virus. Treatment and vaccines are in development. How do we prevent transmission of the virus? This new virus currently has a limited geographic spread. However, there are a number of standard hygiene practices that have been recommended to protect against infection and further spread. These include covering your mouth and nose when coughing or sneezing with a medical mask, tissue, or flexed elbow, avoiding close contact with those who are unwell, the appropriate use of masks and personal protective equipment, especially in a healthcare setting, washing hands regularly with soap and water, or alcohol-based hand rub. Actions that can be taken to prevent infection from an animal source include avoiding unnecessary unprotected contact with animals, washing hands after contact with animals or animal products, and ensuring that animal products are cooked thoroughly before they're consumed. It's important to stay home if you're feeling unwell, but if you have a fever, cough, and difficulty breathing, seek medical care early and share your previous travel history with your healthcare provider. That's a quick look at this emerging infectious disease. Given that this outbreak is evolving rapidly, what's known about this virus can change. Please check the websites below for the most up-to-date information.
Right, thank you for watching. Let's have a look at our questions again. So how contagious is this disease? Try to answer the question yourself. Try to use the vocabulary I have suggested previously. Contagious? Yes. How can you easily pick it up? Number 2, what are the symptoms of the disease? Let's have a look at the infographics showing the main symptoms of COVID-19. Number 1, a dry and continuous cough. Number 2, fever where your chest or back feels hot. Number 3, tiredness. And number 4, other flu-like symptoms, sore throat, aches, and runny nose. Once you see these symptoms in you, your family, or your friend, follow the advice, contact the doctor, avoid going straight to the hospital, use the telephone, dial the doctor's number, describe your symptoms. The doctor will advise you whether you have to visit the hospital to make an appointment or whether the doctors will come and see you. Let's come back to question number 3 from the video that we've seen. How do we prevent it from spreading? As you see, the rules are simple. We all should stay home. That is advice we are to follow. We have to protect ourselves from catching the disease and from transferring it to others. That's easy to do. Of course, wear the mask when you are in touch with other people. Keep the social distance, which is at least 1.5 meters. And remember to sterilize the surfaces that you touch and that lots of people touch in public places. So this is what we have in 2020. This is something that we never used before in such big quantities. But these are the simple rules we have to follow to prevent the disease from spreading. And the last question we all ask ourselves, and we're looking for the answer: how do we stay safe? The doctors don't know, the researchers don't know, the richest countries on this planet do not know. Let's stay safe by following the rules that we hear every day of staying home, by protecting the vulnerable. In our case, the vulnerable are the elderly people and the pregnant people. And the most important are the doctors and nurses, those who take care of the people who do have COVID or those who have other diseases but are in danger due to the lack of medical personnel and equipment. Let's follow the simple rules to prevent it from spreading and to stay safe. I suggest you read the text. And when you read it, remember about interesting technique, which I use in my personal life, in my teaching, and when I'm asked to give a presentation or talk at a public event. It's called teach to learn. When you're going to read the text, take a piece of paper and a pen or a pencil and take notes of the most important items. How do we protect ourselves from the virus? The technique of teach to learn is when you are reading, when you are learning, when you are listening to something, remember that later you might be asked to teach someone this information. I'm sure each of you can spread this information and protect your family, your friends, and all the Ukrainians. Let's read the text together. Pay attention to the underlined words. They will help you later to write your own story, your own text. Let it be the plan, let it be the infographics, or the messages you will be spreading later. COVID-19 is an infectious disease caused by a coronavirus introduced to humans for the first time. It is spread from person to person, mainly through the droplets produced when an infected person speaks, coughs, or sneezes. These droplets are too heavy to travel in the air. They only travel approximately 1 meter and quickly settle on surfaces. This is the reason person-to-person spread is happening mainly between close contacts. The exact time that the virus can survive is not yet known. So it is wise to clean surfaces regularly, particularly. Our hands touch many surfaces which can be contaminated with the virus. You should therefore avoid touching your eyes, nose, mouth, since contaminated hands can transfer the virus from the surface to yourself. When coughing or sneezing, cover your mouth and nose with the band of your elbow or use a disposable tissue. When a tissue is used, discard it immediately into a closed bin. The most effective way to prevent the spread of the new coronavirus is to clean your hands frequently with an alcohol-based hand rub or soap and water. This will eliminate the virus if it is on your hands. Stay healthy and prevent the spread of COVID-19. Now, I suggest that you not only work on the text. Why don't you make the video and teach your family and friends and others on the globe how to prevent it from spreading? The advice is simple. 1 meter distance between you and the person you are talking to. When you cough, sneeze, please, if you can, use a tissue, disposable tissue, the tissue that you dispose right after using or immediately after you use it. Use closed bins for your disposable tissues. If you don't have a tissue by your hand, use the elbow, bend it, and you can cough or sneeze there. Stay at home is the most important message for all of us. Not only can you catch the disease, you can easily spread it by touching the surfaces. As we've seen on the video previously, the droplets do go on the surfaces. If you do not disinfect them, it stays there. And the research doesn't know the answer yet to how long it stays there, whether it's 10 days, 2 weeks, or longer periods of time. The mask does protect you. However, remember there are rules how to put it on and how to take it off. I've been wearing this mask for 3 hours and it's time for me to exchange it. Before I can remove the mask from my face, I first have to disinfect my hands. I can then do not touch the face, remove the mask, and put it into disposable bin so that it doesn't spread the virus anymore. Let's have a look at the useful vocabulary from the text, which I suggest you use in your stories, videos, or infographics, whatever you decide to create. Caused by, mainly through the droplets, approximately, settle on surfaces, spread, survive, contaminated, avoid touching, disposable tissue, immediately, to prevent the spread, frequently, eliminate the virus. Right, at the beginning I didn't mention how much the COVID-19 has changed our lives. Let's have a look at the first aspect. The first and the most important for me is social. The social distancing that we have to keep, the stay-at-home rules, this has changed how we communicate. Let's have a look at this picture. Masks, 1 meter one from another, no parties, no group gatherings, social distancing, the new word phrase in our vocabulary. Let's have a look at this slide. What has changed in education? Students, pupils, parents, teachers. Now everyone has become an expert in online learning. Oh yes, my 7-year-old son has online lessons. My daughter has lessons online. I teach online. My colleagues teach online. Isn't it amazing? Frustrating? Both. Entertainment. I'm not sure we did pay attention previously to how important it is for us to get together, to be able to go to the cinema or theater or the concert or the show. Now it has changed. We do watch concerts online. We do go to the museums online. We watch dramas online. I'm grateful to all the artists, all the performers who do give us an opportunity to watch their shows online. On the screen you can see how those concerts are made. COVID pandemic has changed the way we travel, has changed the way that transport operates. Public transport has stopped working and it hasn't been operating in Kiev for about 2 months now. All the flights have been cancelled, all the borders have been closed. We all hope to get back to normal life, but let's follow the simple rules to make it work. The world economy has suffered, both huge multinational companies and small businesses, such as cafes, restaurants, hotels. Yes, let's hope to get back to normal life. Let's hope all the businesses will get back to work and will be able to enjoy their services, and they'll be able to continue making the money for their families and businesses to develop. COVID-19 is everywhere. It's in news. The children talk about that. The grandparents talk about that. We talk about that with my colleagues. Lots of sources of information. I hope you did learn some useful vocabulary that will make it possible for you to communicate what you think of COVID, what your opinion about how to stop it. Maybe you are the one working on the research on how to stop it. There are many various sources of information concerning COVID-19. However, I would trust the one by World Health Organization. You can always go to the website, see the latest updates, see the latest videos on how to prevent it from spreading, how to stay safe. And as you've seen from the previous screen, you can as well learn what is happening not only all over the world, but in Ukraine as well. Stay at home, stay healthy. Let's hope we will never, ever face anything as bad as COVID-19.